I know you're nervous, honey. It'll be okay.
I know, as long as we're here, hon.
I want to stay with you.
Okay. Thank you. Yeah, be here.
Hi there.
Hi, how you doing?
Mr. Chavez, I'm Denise from IV Therapy. I'm here to place a PICC line in you. Just going to real quick look and check your orders. I see you've already signed your consent.
Yes, I have.
Have they explained what a PICC line is to you?
Not necessarily, but
I see that you have this brochure. Do you have any questions?
No, not necessarily. The brochure really says what it's supposed to say.
Well, I'd like to just explain what I'm going to do to you, okay? This is an ultrasound machine, and I'm going to use it to find a vein in your upper arm here. And then I'm going to start almost like an IV, but I'm going to thread a catheter through it. And the catheter is going to go up your arm, into your chest, and it's going to land right above your heart. That's the best place for you to get your antibiotics.
Will I be able to feel it going in?
No, and I'll give you some lidocaine. So you will be able to feel the lidocaine. It stings a little bit.
Right.
We can't do anything about that. That's the medicine. But after that, it'll be numb. You might feel a little bit of pressure.
Okay. Can my wife stay here?
No, I'm sorry. This is a sterile procedure, so I have to gown and drape him. But I'll have you stay out in the waiting room, and when I'm done, I'll come and get you, okay? You can stay here until I'm ready to start. I need to measure his arm and find a vein. Mr. Chavez, the reason your doctor ordered this PICC line is so that you can have your antibiotics. And I need to tell you just a few risks that are involved.
All right.
Okay, this is an invasive procedure, so with any invasive procedure, you're going to have a risk of bleeding, or you can have a risk of infection. For this particular procedure, there's also a risk of blood clot. And if you do get a blood clot in the PICC line itself, we can put some enzymes in there and dissolve it.
All right.
But every now and then, some people might get a blood clot in their vessel, and that would be a little bit more severe.
Okay. How long will it take?
For me to put the PICC in?
Yes, the whole thing.
It takes about 45 minutes.
Okay.
Most of that time is me unwrapping packages, though. The actual procedure takes about 15 minutes.
Okay, that's fine.
Okay, and the last risk is I could hit a nerve. I've hardly ever hit a nerve. I've done this for years, and I've only hit 2 nerves. But if it happens to you, it will zap you, and I'll pull out right away.
Okay, fine.
Okay, you ready?
Yes, ma'am.
So now I need to clear off your table, and then we'll get some measurements.
Okay, can I see that little magazine, please?
Sure.
Oh, thank you.
Okay, I'm going to do some measurements now. I'm going to put this tourniquet on you and measure your arm.
Okay.
Have you put your arm out to the side. Does that hurt you at all?
No, it's just fine, thank you.
Okay, go ahead and relax it. You know what, I need to put your head down some.
Why is that?
Because I can't get your arm straight. I need to get into the inner part of your arm. It's just going to hang here for a second. This is going to be cold.
Go ahead.
Just looking for your vein here. Nice.
Nice vein.
Nice big vein. I'm going to take some measurements now. Measure it twice. Measure twice, cut once. Is that what they say?
That's what I say, I guess.
Okay, go ahead and just relax.
All right.
It's going to take a while. I'm going to open some packages. You'll see me with a gown and a mask on, so
Okay.
I'm not Darth Vader. Okay, now that I have my equipment ready, I'm going to drape you.
Okay.
This is to keep everything sterile to prevent you from getting an infection. So, this is mine, and I don't want you to touch it because it's sterile. Your left hand can stay underneath it. Your right hand I'll need. Okay, go ahead and give me your hand. There you go. Now I am going to wash your arm with this chlorhexidine, and it is going to be cold. And it's stinky.
Really?
Yeah. It smells real alcohol-y, so it's real strong. You might want to look that way. Okay, go ahead and lay your arm down. Straight down. There you go. Okay, now I don't want you to breathe on this, okay? So I want you to look over to that side. Okay, Mr. Chavez, I'm going to give you a little poke. This is going to sting a little. Wait, stop. Okay, Mr. Chavez, all of the parts that hurt are finished. I just have to thread the catheter through.
You was fast.
Yeah, it doesn't take that long.
No, it doesn't.
It takes longer to open all the packages. I'm going to cut it to fit. That's why I did those measurements. Okay, I'm going to take a look in your neck, okay? This is going to be a little bit cold. Okay, because the catheter was sticking up there. Okay, now I want you to tell me if you hear anything unusual in your right ear, any swishy, watery sounds. Nothing?
Nothing.
Okay, that's good. I didn't want you to hear anything. I don't see anything, so I think we're good. Mr. Chavez, we're almost finished. All I have to do is put the dressing on. Just going to clean it off a little. There you go.
Oh, thank you.
In a couple days, IV Therapy will come in and change this dressing. Right now, it's kind of bulky. We'll take this big dressing off and just put a clear dressing so that we can see the site and monitor it and make sure that it's okay for as long as you have your antibiotics. So a couple things I want you to know. Every day, IV Therapy will come in and take a look at this. Make sure that the dressing is nice and tight. If it needs a new dressing, then we'll be the ones to do it. We'll also, whenever you do need a change of a dressing, we'll change it. We'll also be the ones to come in and draw blood out of it if you need blood drawn. That way, only a limited amount of nurses are touching your PICC line, so it helps to prevent any bloodstream infections. And lastly, I'm going to go order a chest x-ray for you. You need a chest x-ray so that we know exactly where the tip is.
Okay, thank you very much.
Okay?